Welcome to Talking Faces, where we discuss everything relevant to facial aesthetics. We're in our London studios. My name is Dr. Raul Cetto, and I'm joined by my co-host,
Lee Walker. Hello, everybody.
And this is our first episode today, so we are going to be discussing training in facial aesthetics in the United Kingdom. So I'll open up the panel and I'll start by asking my co-host about regulations. Good thing, bad thing? What do you think?
I think it's always a good thing to have regulations within any industry for safety, really. But I think we need to pose a question, and I'll ask you the question, Raul, because I think you'd be really good for this. Is one day enough for training in competency with medical aesthetics training in the UK?
So that's the old see one, do one, teach one scenario. No is the answer. Definite no. However, this is how the industry has been structured for a very long time. So when I started back in 2010, 2011, there was no formal structure in terms of how to train. So what we had is 1-day courses, 2-day courses, and really that was it. You buy insurance and you buy the products and then you can do the treatments. However, things are, I believe, are evolving, things are changing.
I think things have to evolve, really, because when I did my training around 2001, it was exactly the same. It's really based around economics. You do the course, you go back the next day and you hopefully have a cohort of patients lined up and ready to get your money back. And I think what we sadly lack within the industry is a pathway of progression. We don't have these steps to really go through like we do within a university or a surgical training, and I think we miss that. I think we miss that as medical professionals. We miss that there is a pathway to it. But I feel it's just an economic base really for training now. Just get in quick and get out quick, but it doesn't build in competency or confidence with injectors.
Absolutely. So you touched on a very important point, which is the competency. Whenever we're training, for example, during my surgical training, is a competency-based training system. So there's a core number of competencies that you have to cover, and you're actually assessed in every single one of them. And then you have year 1, year 2, so there's a formal structure to the training. And then at the end, you're assessed again, and then you have an exam or something like that, and then you have your qualification. So this is one of the things that we're missing in the industry, and I think only recently you start seeing more and more in terms of competency-based training. However, because of the lack of regulation at the moment and the fact that probably it's not considered a standalone speciality and it's so multidisciplinary, that's probably one of the reasons why it hasn't taken off.
I think when you look at regulations, you've got to look at not just the people who are injecting, but the people who are training. Because I always think about trainers with the sort of archaic methods on how they teach and what they're teaching, and who trains the trainer, and do they have a formal qualification in clinical education. I always think about bad drivers teaching bad drivers how to drive bad, and suddenly we all become bad. So we've got to look at got to go back to source and think, is our training good enough? Are we competent? Because lots of training companies won't, and I understand the reasons why, is that they won't give a certificate of competence, they give a certificate of attendance, and this is very, very different to being a competent injector. And I would love if somebody to give me the figures based around fallout or lack of people injecting post-course. Do they have the confidence, do they have the transferable skill sets to be injecting safely and predictably with the face? Because within aesthetic medicine, it's you judge based on your results of how you feel it, not have you done the treatment safely, but what are the results like? So I think we need to go back. Do we need to have this thing, aesthetic medicine, as an undergraduate, or do you need to have a transferable skill set and use this as a postgraduate, as a speciality, as a standalone vocational degree? The question needs to be answered.
Absolutely. So you touched on a couple of very interesting points there, Lee. Number one, you mentioned evidence-based training. So I think one of the things that have changed the most in our industry over the last decade is that now we have a wealth of evidence. So number one, we have evidence now. And also we have different technologies, etc., that we can use even to quantify learning as well for our trainees. And the number one thing I think people should be asking themselves when they're looking for a training provider for a course is, yes, what are their qualifications, number one? And also, what is their track record? What do we have that is quantifiable and that actually means that you can sign up for a course that is evidence-based, that is actually touching on all these points, and not just an exercise where you're going to treat between 5 of you, one patient, and passing around a syringe, and really not have that confidence when it comes to treating patients. Because that is something that we do see a lot, that people have invested all this money because it is expensive to train in aesthetics, and then they leave that 2-day course and they just don't have the confidence. And one of the things that we need to factor in, I believe, is the fact that we're a multidisciplinary speciality, number one. So the starting point will really vary depending on what your background is. And I think this is very important because it has to be taken into account. This has to be taken into account when developing a training program for someone. I think it can't be really the same program for everybody. What do you think?
I agree, it's not a one-size-fits-everyone approach, and I think one of the things that trainers need to do is take off their aesthetic injector's hat and put on their clinical educator's hat, because everybody will have a different learning style when it comes to how they sort of get their knowledge and how they assimilate it and how they use it within their job. And I think for too long it's just been, I'm going to show you how and none of the why type of approach to this. And you have to identify learning styles. Who are your visual learners, who are your auditory learners, who are your kinesthetic? Does your training allow to sort of meet the demands of all of those training? And that only comes from having a qualification in clinical education. And if you look at the evidence, because as well as me for a long time, we've been really led by this eminence base. So how famous you are is how you teach, and people will just follow you. I wouldn't say blindly, but they will follow you because, this eminence base. Now, if you look at papers or publications based around training, then there is available literature out there. You've got the Kumar and Swift consensus paper on what should be taught with facial anatomy. It's 154 structures that you should be teaching. Can you teach that in one day?
No, is the answer. And I mean, I'd like to ask you, back in the Stone Age when you trained, how was the training structured then?
The training was structured from a university point or from a medical aesthetics point? From
the medical aesthetics point. So you're already, this is postgraduate, right? So you finish your qualification and then you want to go into facial aesthetics. How did you go about it?
How you accessed courses then was just word of mouth. So you'd ask somebody where they did the training, and all of a sudden then you would land up on somebody's doorstep, and it was literally somebody's doorstep for me. It wasn't in a medical facility or a university. It was actually somebody's house I went to, and it was the classic around the bed, pass the syringe around, grab a certificate, get your insurance and go. And at that time, almost 2 decades ago now, or the Stone Age as you call it, you really didn't have the publications or the literature available or the training pathway to go through. So it was a classic case of learn on the job and sort of learning by your mistakes. I don't think that's the best way we can do things from a medical aesthetics point of view. So I think now we have, again, Kumar is a real advocate of medical education within their papers, and they're saying that cadaveric work should come first because most people will learn the in-depth 3D anatomy of the face. And on those day courses, unfortunately, you don't have the resources and you don't have the time. It's basically just it's a point and shoot approach. So just 1, 2, 3, and then away you go. So for me, these things have to change, and it's for trainers like ourselves to try and break the culture of this sort of quick, fast, because it's not conducive to safety, in my opinion.
No, you're absolutely right. And, interestingly enough, almost 10 years after your first training that you described, I started doing my first courses. And what I found was very, very similar. It was, yes, being by a training provider, usually, it's these pharma companies that provide training, but it was very, very similar. It was the same structure. You go to one course, which is Introduction to Botulinum Toxin and Dermal Fillers. you treat a couple of patients, which you're sharing there the treatment with other delegates. You get your insurance, and off you go, right? And that's the thing. That's the problem with training. But now, fast forward 9 years later, I think now we have, as you said, more evidence, but we also have different structures in terms of training. So some of the things that we have nowadays are postgraduate qualifications. So these are offered either by private training providers or by universities. And these are standardized, the government regulated syllabus, etc., which involves a theoretical and also practical component, which I think it's great for the industry that it's moving forward that way. But I think one of the things that we must understand is these are almost entry-level exams. So like, for example, when we were doing surgical training, there's an entry exam, which is a membership for the Royal College of Surgeons, then there's an exit exam, which is a fellowship. So we haven't really gotten to that stage where there's an exit exam or there is a college that is actually officially governing aesthetic practice. But I think things are moving in the right way, hopefully.
Well, I mean, if you look at the qualifications available for aesthetic medicine in our field, then you've got the traditional one-day course, shake a hand, give a certificate, and then you have the postgraduate certificates in different guises, the level 7, and then you have a postgraduate sort of entry, so to say, into medical aesthetics through universities, PG DIP, and all the way to MSc. There's even now online cosmetic medicine degrees for aesthetic medicine. And again, I'm going to ask you the question, Raul, is do we feel that really these vocational qualifications, do they have enough hands-on components? Because I'm aware that you just have to submit cases to most of these things rather than having this competency-based. Like when I was at dental school, we had to do a certain amount of procedures that were an acceptable level. If you didn't, then you didn't go through to the next stage. You didn't qualify. We don't have that. So one of the questions we need to ask is: A, is there enough hands-on, and who trains the trainer to be competent?
So two interesting, different questions there. Number one, in terms of the postgraduate certificates or qualifications that we have, the one I did, the practical component involved obviously the theory, but the practical component had 10 observed treatments for each modality and 10 supervised treatments for each treatment modalities. However, the syllabus in terms of what treatments we will undergo was what is considered quite basic. Now, who trains the trainer? That's an important one, because I think that you have a postgraduate qualification in clinical education. I did courses in clinical education as part of my my training. However, I think it's a very, very important thing that you touched on, because it's not just the celebrity status, or can you actually do it, can you achieve great results when you do it. Is, are you a qualified teacher? This is the most important thing. And I think this is something that I've not really seen that much in the industry. And I've seen very few people that actually have qualifications in teaching, because it is incredibly important, especially when you're dealing or when you're teaching this multidisciplinary faculty. You have people from so many backgrounds to teach, and it's very important that you're able to identify their needs and also their learning styles, correct?
Yeah.
I mean, you see that all the time.
I do, and you have these different skill sets, which is great for aesthetic medicine, because you're coming in from sort of a multitude of angles.
I love it.
But you've also got the basic fundamentals of people's A&P knowledge. So you're trying to teach anatomy, which is incredibly complex, incredibly variable, to people who really have not touched on the face too much. And I think that, again, we do things in this country back to front when it comes to training. We teach how to do it, but we don't teach about anatomy, we don't teach about complications. And I feel that that doesn't give the practitioner coming into the industry an informed decision on whether they want to carry on. Because if somebody would have showed me the cases of blindness or stroke or necrosis, if I had to do cadaveric training before, then maybe I'd have those question marks into thinking, wow, this is not exactly what I've signed up for. It's quite
absolutely.
it's a risk. It's
you take a step back and you actually you start taking it seriously, right?
Well, we have to take it seriously because when I started, we didn't, and I'm ashamed to say this to everybody, but we didn't have hyaluronidase available. We didn't know what it was. It wasn't for us. It was for ophthalmics and other areas of medicine. So we were injecting, I would say, blindly without the use of hyaluronidase. And how we got away with stuff, I don't know. If I look back at myself over the years, I think, no, I would never put myself in that position again. It's because we didn't know what we didn't know. But now we can give the new people coming through into the industry that informed decision if we have the training in the right structure and in the right way, not this sort of back to front, but the front to back. So show them everything before they inject. So all of the why, and then we show you how, because now it's the how and none of the why, if that makes sense.
Yeah, no, it absolutely does. I think this has been a brilliant insight in terms of the current status and a little bit of the evolution of education for medical aesthetics. One thing I'd like to ask Lee, from your experience, what is the number one topic or number one type of course that you would just suggest for everybody as a must? One.
Well, it's quite an easy one. Yeah. I think one of the things at university that we really don't appreciate, I certainly didn't appreciate, so I'll talk from my own experience, is cadaveric training. It was a hurdle to jump over to get through to get your qualification, and you really weren't educated in the gift that you were given. Someone's given their body to medical science and to your education. So my number one course would be the anatomy relative to facial injection. I think that will give you that 3D real perspective on where to inject, and if you can do something like the inject and dissect, you try yourself, and then you can pull back the layers, and it really gives you that respect for the facial anatomy that it really needs.
It's quite an insight, actually. We've done a few together, and it's quite an insight when you inject dyed filler and then you actually get to dissect, and you're doing the same techniques you do every day, and then you get to dissect, you're like, oh wow, is that where the product is? It's quite an eye opener. From me, I think, Lee, brilliant recommendation there with the anatomy. I think I would also recommend a complications course or complications training. It's paramount importance, really, to be aware of the actual complications that you might encounter when carrying out aesthetic treatments. I think it's very, very important training to do. And
if you can marry those two up on a course over 2 days with people who are knowledgeable and experienced too, because knowledge and experience have to go together. If we do the two first and we have this front to back training, then I think that would be the platform to the safer and more predictable injector.
Absolutely. And we'd like to thank you all for joining us today. Please leave your comments below and let us know what you want to hear in our podcast and our YouTube channel. So we're going to be aiming to do at least 3 or 4 of these every month, but we want to cover all the topics that are relevant to you, whatever you want to hear. And I'm just going to finish up to asking Lee, where can people find you, Lee?
They can find me normally with Toxie, with you, or they can find me in Liverpool at the Lee Walker Academy. You can follow us on Facebook, and we provide pretty much everything that you would need for your aesthetic career in terms of training, and more importantly, an evidence-based method of training.
And you can find me on Instagram, Dr. Cetto at Instagram, so DRCETTO, and we'll post our adventures across the world, and we look forward to seeing you here in the future. Thank you.
Thank you.